Fantastic. Good evening, everyone, and welcome, and thank you for joining us this evening as we consider the many profound and often troubling relationships among migration, climate change, and human health around the world. For those of you who don't know me, I am Fumi Olopade. I'm a professor of medicine and human genetics and serve as Associate Dean for Clinical Sciences, Global Health at the University of Chicago. I'm a member of the board for the Chicago Council on Global Affairs. And I first really want to acknowledge my distinguished colleagues who are here, and also to thank retired Ambassador Ivo Dadler for really taking up my idea to do something different by bringing someone who cares about sub-Saharan Africa to engage all of us today. And I know that some of you have come to events here multiple times and you know the programming, but I really want to encourage our students and young people who are joining from all over the world to put in questions at the end of our chat. And as my colleagues in Nigeria would say it, I know that there are many distinguished guests here, so I'm just going to say all protocols observed, and just really begin this evening. Because what we wanted to do with this programming is to come together as the Center for Global Health at the University of Chicago and the Susan and Richard Kiphart Center for Global Health and Social Development to celebrate World Health Day. And World Health Day means that the global community should come together and think about problems of vulnerable populations all over the world. And this year has certainly been very challenging for all of us in the global health community as we have watched unending conflicts and devastations all over the world. It is indeed my honor to introduce you to a leading authority on the relationship between climate change, human migration, and global health, our keynote speaker, Dr. Ibrahim Abubakar. Professor Abubakar is the Dean of the Faculty of Public Health Sciences at University College London, a professor of infectious diseases epidemiology at UCL, and a senior investigator at the United Kingdom's National Institute of Health Research. Now, when he landed in Chicago today and I met him, we were so happy that it was a beautiful, nice, warm day in Chicago. And the only thing he could say, well, I hope this is El Nino or maybe it's climate change and we're all doomed. So rather than enjoy the sun, he was concerned about climate. And that's really how many of us feel about a beautiful day in Chicago that we should enjoy, but we're concerned that this is really not Chicago. It should be freezing in April, but here we are. It's a beautiful day. To further introduce Professor Abubakar, under his able chairmanship, the Lancet Commission on Migration and Health has recently brought forth an important and groundbreaking report titled The Health of a World on the Move. The report identifies migration, whether due to conflict, climate change, or other causes, as an understudied determinant of health. It presents a broad transdisciplinary base of evidence to support the conclusion that health should be at the center of the macroeconomic debate on population movement. With millions of people on the move today, I'm excited to hear with you Professor Abubakar's thoughts on how we may tackle migration as a priority area in global health. After Professor Abubakar's keynote, we will welcome Dr. Maya Prabhu to join him in discussion of issues surrounding migration, climate change, and global health. Dr. Prabhu is an associate professor in the Department of Psychiatry at the Yale School of Medicine and is a clinical associate professor of law at the Yale Law School. She's a medical doctor and a lawyer. In 2005, as deputy counsel for the Independent Inquiry Commission, the Volcker Inquiry, Dr. Prabhu investigated allegations of fraud and corruption in the United Nations Oil for Food program. Her current research interests include global health, forensic psychiatry, post-traumatic stress disorder in post-conflict situations, and numerous other issues at the nexus of health and human rights. So thank you, and please join me in welcoming Professor Ibrahim Abubakar.
Thank you, Professor Olopade, for that very kind introduction. I'd like to start by thanking the Chicago Council for Global Affairs and the Center for Global Health at the University of Chicago for the honor and privilege to speak to you this evening. And I'm looking forward to my time. Believe me, I am not upset that the weather is fantastic. Great. So this evening, I will be taking you through some of my and my colleagues' work on the climate crisis, its intersection with global population movement and impact on health. And then I'll be covering a few issues on what I think might be the solutions that we should be looking at. So if I was to ask anybody in this audience or online, if 5 years ago, before the pandemic, that you approach any American president, including 45, and ask them if they spend less than a quarter of the federal budget and can prevent 7 million deaths worldwide, do you think the answer would be no? What about if we said 1.2 million of those would be Americans? That's 3 times the number that died in the Second World War. Would they say no to that question? That's exactly what happened. In 2005, we wrote in a book on infectious disease epidemiology, and I remember writing this, that a coronavirus like the then Middle Eastern coronavirus may cause a pandemic. Others, as this Time magazine headline in 2017, said the world was not ready. In 2019, the Global Preparedness Monitoring Board, which I'm now a member of, which was convened by the WHO and the World Bank, said exactly that the world was not ready for a pandemic. Unfortunately, we know now that 7 million deaths later, not only did we not prepare for the previous pandemic, we're still not ready for the next one. In a comprehensive report we worked on last year, we looked at a variety of questions using a framework and determined that the world is not ready. My conclusion is this tragedy and the inability of the world to prepare suggests to me that for an even bigger, slowly unfolding crisis, which is the impact of anthropogenic climate change, and all of the models support this. So this piece of work by the IPCC suggests that by the mid of this century, if we don't act, 1 billion people that live in coastal areas would be at risk, and we expect tens of millions to be on the move with obvious health consequences. If you look at the breakdown, so looking at the World Bank's groundswell report, this graph just shows you the distribution of using various scenarios of how many people would be affected by internal displacement by 2050. And whichever scenario, however optimistic you are, we are talking about tens of millions of people displaced. Sadly, this displacement will be in the places with the weakest health systems, with the highest levels of poverty and challenges, distributed in sub-Saharan Africa, in Asia, and across Latin America, to a lesser extent affecting Europe and elsewhere. Therefore, they are the places where, if there are health consequences, then the impact would be outsized. Before we go away thinking, well, this is a problem of the poorest people in the world, and this is a developing country problem, this figure from a UNICEF report in 2020 looked at current weather events at that point in time. So this is not anthropogenic climate change necessarily, but weather events and crises. And the largest number of the place with the largest number of kids affected by displacement and consequently potentially having poorer health outcomes are indeed the two biggest economies in the world, the US and China. When anthropogenic climate change arrives, it's going to affect all of us. It might start at the poorest places, but ultimately it's a global health problem. It is therefore, I'd argue, in our enlightened self-interest to tackle both pandemic preparedness and the climate crisis because they are two interrelated problems. Indeed, if we fail to act, there will be another pandemic. Not only that there will be another pandemic, it will be made more likely because of the climate crisis, and the effects will be much bigger because we failed to tackle the climate crisis. So I'll talk a little bit about migration as a subject, and this is partly from our commission report from a few years back. Most migration, most people do not realize, is actually driven by labor, economic opportunity, and people's desire for a better life. It's the majority of migrants internationally. And a lot of migration, about 40% or thereabouts, happens in the global south and does not affect wealthy countries in the global north. But most people, because all the media coverage is about the Mediterranean Sea and the southern border of Europe, think migration is all at these two places. The climate crisis would be essentially that. It will make people move within countries first, and then ultimately they would move internationally. And initially they would move to neighboring countries, but there is no choice other than getting trapped where you are, but to move elsewhere. The risk of health or ill health in the context of migration will be determined by the conditions before you left, how you traveled across your journey to the new destination, and what you find when you arrive in the country that you settle in, and other factors as to how we respond to migrants. Migration is, of course, deeply, deeply political. I've already alluded to the US border. At the last election, the incredible coverage by the media, including using migration to imply that migrants bring in disease. Migrants are the causes of several ills in society. In the United Kingdom, where I am from, our Brexit tragedy started unfolding by attacks on the funding of healthcare and the politicians implying that actually because of migration, migrants are coming in and inundating the health system, and that if we left the EU, our National Health Service would gain an extra £350 million a week. All misleading stories that have not transpired. Migration remains deeply political, and I'm sure it will have a major part to play at the next election here, as it continues to do in the UK, with many of our political leaders coming out with rhetoric that is incorrect and really harmful to everyone. Global migration policy has also been topical from the inception of the UN and related agencies of the United Nations. There have been a series of policy documents, which we summarize in our report, culminating more recently in two global compacts, one on migration and one on refugees. And those compacts outline what we should do around migration. So this figure essentially looks at the intersection of climate change, migration, and health. At the top level in blue are the factors that underpin what happens when greenhouse emission increases to levels that we don't want it to, post-industrial levels. And there will be increased global warming, there will be increased rises in sea level, but at the same time, there will be increased pollutants and also effects on the ozone layer that is damaging. The consequences of this is increases in the number of disasters like droughts, floods, the sea levels that would famine, and all of those consequences. And then those would lead to effects directly on health. The pathways are very clear. There will be increases in respiratory illnesses. There will be effects on physical health. There will be effects on mental health, and there will be consequences on increases in infectious diseases. What we do is respond to them, either through conflict because of the effects of labor or decrease in resources or water, or we migrate, or we become trapped. And all of those would have an effect as determinants of health. And how we respond may mean that migration is a healthy adaptation or migration becomes a toxic adaptation. The projections in the Lancet Countdown report are that if we fail to act on the commitment to keep global warming to below 1.5 degrees, and we allow global temperatures to be up to 2 degrees above pre-industrial level by the middle of this century, there will be a fourfold increase in yearly heat-related death among people over the age of 65. There will be a 50% increase in labor loss due to heat. There will be nearly 500 million people experiencing moderate to severe food insecurity, and there will be 37% increase in the transmission of dengue. To just look at that in a little bit more detail, if you think about the communities that live in coastal areas within 1 meter of the current sea level, projections by the last Lancet Countdown report are that about 150 million are in these spaces, and they would have no choice but to move if sea levels rise. It doesn't stop there. Most countries recognize this and produce multiple policy reports. And when they looked critically at all those reports, they concluded that actually none of the 52 reports identified in over 40 countries mention health. So we are not getting ready for the health consequences of migration. You could look at food security. Again, when you look at figures, there's 29% more areas of the global landmass affected by extreme drought. In places like the Horn of Africa, 12 months around the year, they suffer from drought. Not surprisingly, the consequence of this would be food insecurity, water insecurity, and challenges with sanitation. And of course, people would move or be trapped and die. If we look at heat-related mortality, so I alluded to the increase among the over 65 of heat-related mortality. So this modeling by Lancet Countdown suggests that as a consequence of climate change, we've had almost a doubling of heat-related mortality. The observed rates between the decade 1990 to 2000 compared to the decade up to 2022 was 85% increase in heat-related mortality. The counterfactual, if you remove anthropogenic climate change, is actually a 38% increase. The other way the climate crisis acts is by affecting the economy and labor. For the poorest countries in the world, which is what this graph shows, the effects on agriculture would mean that increase in heat would lead to a large decrease in GDP of the orders of 6%. So people would lose employment, and what would they do? They will migrate to find opportunity elsewhere. The estimates of the global loss is around $863 billion in 2022 alone. What about susceptibility to infectious diseases, an area I care deeply about? Well, we know that even this year, about 10% of the global coastline has evolved into a condition that increases the risk of diseases such as Vibrio. And that story continues. If you look at malaria, dengue, there are proven evidence that we're heading in that direction with increase in transmission of those diseases. And this slide just summarizes all the different harms. Before I move on to the solutions, which I would cover briefly, I'd want to be very clear that all of these facts I alluded to required really thorough analysis and careful investigation, because when we don't do proper attribution studies, climate skeptics and conspiracy theorists would pick the one example why it's not proven and send the wrong messages. So when we do this work, we all have a responsibility to make sure it's as thorough and responsible and scientifically valid. And there's fortunately good science and evidence for that. So I'll briefly talk about, from my perspective, what I see as the solutions and opportunities. So the obvious thing to do is that we need to decrease our carbon footprint and reduce the source of the anthropogenic climate change, but we also need to act on mitigation and adaptation. So starting with tackling the carbon footprint from a very health perspective, one thing I'm very clear about and very passionate about is the idea that the carbon footprint of health systems, of our large hospitals, of our primary healthcare centers need to be thought through. And I'm delighted that the WHO is leading the Alliance for Transformative Action on Climate Change and Health, which is working with countries to ensure that we're able to, in fact, act on health systems and reduce their carbon footprint. But at the same time, we must also think about how do we use health to convince people to act in the context of climate change. This is where the Lancet Pathfinder Commission comes in. They talk about the concept of health co-benefits, where if we do the right thing and grow food sustainably, we'd actually benefit from decreasing chronic diseases. If we build our houses better and more sustainably, while tackling climate change, we could have better quality of life for people. So there are multiple areas of action documented in that commission that shows that you could actually use health to justify climate action, which is an incredible opportunity. Of course, we must have research and innovation. We must have legal drivers and be able to convince governments and society to tackle anthropogenic climate change. We must tackle the commercial drivers of pollution and the climate crisis. But ultimately, it's going to be political, and it will require all of society to act. What about mitigation and adaptation? We'll come back to this in a little bit more detail, I hope, in the chat. But essentially, we know that we are already on a trajectory that there will be consequences of anthropogenic climate change because it's beginning to happen around the world. And there, we must take a number of measures, including ensuring that the health harms are reduced by making sure that any measures we take are just and that we don't allow the most vulnerable to bear the largest burden of the consequences of anthropogenic climate change, to ensure that we have healthier, low-carbon diets, to work towards climate-resilient health systems so that when there's an emergency or a crisis, our hospitals don't just shut down and they're able to respond, to make sure that we have planned migration and people can move when they need to so that it's a healthy adaptation with access and rights to healthcare, to prepare for emergencies, including in the health system, but more broadly, to what is inevitably going to be elements of the climate crisis, and to equitably share the cost of responding. So a project as an example that I'm working with the colleagues, health policy, health ministers across the Sahel, as well as partners here in the US and elsewhere in the world and academics in Africa, is in the Sahel region, a really important part of the world because, as I alluded to earlier, because the health systems are ill-prepared, because there is increasing population, because the temperatures there are rising, the Sahara is encroaching, the population is growing. If anything is going to go wrong, the Sahel is probably going to be one of the places we're going to see. Other than small island nations where rising sea level could put their lives at risk, this is one of the danger places. So I'm delighted that we're working with partners there, looking at frugal innovation, looking at solutions that are locally developed in loads of areas, including in health systems, but across the economy, to take action on anthropogenic climate change and adapt systems. And I'm looking forward to completing this work with colleagues. So I'd like to conclude by saying health-centered climate action can still deliver a prosperous future for all of us. I do not believe that panicking, despite all of the statistics I've given you, is the answer. Humanity has found solutions to the most grueling challenges, and we can do so again with innovation, with science. We can find the answer to anthropogenic climate change, and we need to work collectively together. We know that our species can innovate. But in doing so, we must remember our humanity. We must be as generous as Europe was to Ukrainian refugees when they were displaced. We must be as generous as the great city of Chicago, as your mayor and the city is to migrants when they arrive here. Thank you.
Thank you so much for that. A pleasure.
Thank
Can
you.
we have another round of applause for our wonderful speaker? Hi, everyone. Thank you so much for coming. It's a pleasure to be in Chicago, a city of great hospitality and great food. And I hope this conversation is interesting to you. I did ask if we could have the mic set up in the middle so that we might take a couple of questions midway through the fireside chats to give you a chance to participate in the discussions and tell us what's on your mind. But we will start. Thank you for that.
Thank you.
So, talking about climate migration is talking about journeys, and the journeys that entire communities will take and that individuals will be forced to take. So I thought you wouldn't mind if we began by a couple of questions about your own journey as well. How did you become a physician? How did you end up in the work that you did? And then I'm curious about your own path to thinking about climate change and climate migration, because when we went to school, climate change was not anywhere near the forefront of our minds, and we have a whole new generation of physicians who will care about it differently. But perhaps you can tell us about your trajectory.
Thank you, Maya. So I trained as a medic in 1980s Nigeria, and there was inequalities all around me. And I've always been passionate and clear in my career and journey that part of my mission as a medic is addressing inequalities. But like every doctor, I finished medical school, did residency and fellowships, and worked in the health service looking after patients. And increasingly see patients come in with preventable diseases, so vaccine preventable diseases. And that led me to a journey where I went and trained further in public health and in clinical medicine, specializing and acquiring accreditation in both areas. As a consequence of that, I also, driven by my curiosity and the desire to make a difference, moved into research, did a PhD, and decided to apply for and secure grants to work on infectious diseases. While working on infectious diseases in Europe, I ended up leading the UK National TB program. And as part of that and associated research work, I distinctly remember a meeting in Southern Europe where we were discussing migration of people, including those that would end up then being diagnosed with TB. And I was staggered in the room to hear that some scientists were alluding to the death of people in the Mediterranean as a security issue rather than as a health issue. And that made me think, in addition to my interest in TB, there are actually important determinants that I needed to focus on. So I was delighted to then move in that direction, secure funding, and working with the Lancet, establish the Lancet Migration Initiative, which consequently resulted in the Lancet Migration Commission. Now, it does not take a giant leap once you start working on migration, especially of the most vulnerable people around the world who are either dying on their journey to here on the US border or a southern border or across Europe, to realize that part of the driver is in fact one of the biggest existential threats to our species, which is anthropogenic climate change. Therefore, as my journey to climate crisis as a medic who sees patients daily to being a climate health researcher and migration health researcher was in fact via my training in infectious disease epidemiology and ultimately migration.
So through lines include inequities, but I think your point about how migration is largely seen as a security, border security, foreign affairs issue rather than primarily health, even though health is critical to what safe, orderly migration processes look like, is really important. And I appreciate you bringing up the migrant deaths in the European, crossing the Mediterranean. The International Organization of Migration has a sort of a study that sort of tries to estimate how many people die every year. And of course, that number is ultimately unknown because we don't know how many people didn't make it across the borders, died in boats that were never, there's certainly very few registered boats. And so I think this idea of deaths unknown is really important. You began by talking about the Lancet migration study, of course. I think, that came out in 2018, which was the time to coincide with the Global Compact on Migration, which was a very important international effort to try to recognize the needs of migration. What are some of the takeaways that you want to expand on? And I think importantly, since we've come through COVID, what are the important developments since that particular report?
Yes, so it's been a fascinating journey. We published the report a couple of years before COVID, and about 5 years has elapsed, and we've had the opportunity to reflect on that. In fact, we have a forthcoming 5-year post-commission review take, which should be coming out hopefully soon, working together with the entire network. What we did was we established regional networks because we ultimately decided that global action, there are numerous agreements, concordats signed. Countries know their obligations, and that if we are going to make a difference, it has to be local. So we established hubs in Latin America, we established hubs in Europe, and elsewhere in the world. And the idea is to work with national governments and subnational level to influence policy in migration and health and access. And I'm delighted with some of the individual bespoke progress that the Commission has managed to ensure. During COVID, many of our collaborators and partners essentially did that working with countries. But sadly, if you look at our key messages about access to healthcare for migrants, which is the key and core message of our Commission report, we're not much further ahead compared to where we are. It's not entirely bad news. There were examples during COVID of incredible generosity by many countries. I'll take Portugal and single them out as an example, where they allowed people to access healthcare and change the status of migrants and allowed them very generous access. And there are several other countries that did that. So there are some lessons to learn about what good practice looks like. But there are also some lessons not to learn about really bad practice, about how, despite the very evident and pertinent nature of infectious diseases being one, where if you don't take care of the most vulnerable in your society because you think they are not entitled, when they get the infection, you will be at risk too. But despite that, many countries fail to act appropriately. But there are numerous examples of where they did act.
I think that's important because I have to say that when you speak about climate change and you speak about the numbers of people who are going to have to be responding, and we should explain some of the terminology around migration studies. What does it mean to adapt? Why do we use the term adaptation when we're describing migration? What do we mean by a planned relocation? People can often have intensely distressed feelings, eco-distress. So I think the examples are really important. You commented on infectious diseases. We've commented on heat. Can we talk a little bit more about some of the just health impacts that are related to climate change so people sort of understand that baseline, and then we'll bring them together with migration patterns?
Yes, so as I alluded to in my talk, climate walks, increasing global temperatures walk through a number of pathways, and ultimately the effects when we mess up the planet completely will be that we'll all demise, right? The species would end. But long before that, there are immediate consequences. So for example, increased global temperatures would lead to drought, and that's already happening in many places. Drought leads to food insecurity, which then means undernutrition. Undernutrition in children that are already vulnerable, and therefore marasmus, kwashiorkor, and protein energy malnutrition, with kids dying in the sort of starvation images that nobody wants to see. We talked about changes in habitats and that vectors utilize, or in ability to have sanitation due to increased temperatures, and the consequence of that is the increased spread of infections. We talked about people essentially fighting for resources because there are no more jobs, and therefore conflict, and conflict results in, unfortunately, lots of deaths and people needlessly losing their lives. Alternatively, they flee. And when they travel through difficult areas, whether it's the Mediterranean, the Sahara, the tough journey it takes across the Americas to get here, people die as a consequence. Along all of these factors, it's not just their physical health that is affected. There is ample evidence to suggest that both as a result of issues such as conflict, torture, but also due to the physical ill health that people suffer, mental health is hugely affected. And the consequence of that would go all the way from having difficulties with people's general well-being, mental health well-being, all the way to people having to commit suicide because they can't cope anymore with the very dire situations, either due to incarceration or some of the difficult situations they found themselves. So I would say there's hardly any health condition or system that you could look at that migration does not affect. I mean, if you want to be really generic, you think about the deaths that result from heat, increased heat in people over the age of 65. Now that tends to be people with cardiovascular disease due to respiratory disease. We know that extremes of temperatures causes increased mortality in those groups, whether it's very cold or very hot temperatures, which anthropogenic climate change is certain to lead to.
You spoke about children, and in the green room and in our prior conversations, we were speaking not just about the physical harms that are going to befall a generation of children, but I was starting to think about their entire psychosocial development and their development needs. Because as we're moving into our discussion about migration, as the adults leave, as adults adapt, as parents go elsewhere to seek remittances to be able to send home, children are going to be left with this group of elderly individuals who will be caretaking them under circumstances of some increasing degradation. Is that right?
Yes.
Can we talk a little bit more about what I fear is going to be a lost, tragic generation of children?
So it's not cliche to say children are the future, right, of the humanity and our prosperity or not. And therefore, if we want to take any action around climate change or migration, it's really, really important that children are at the center and heart of this. You alluded to the fact that a large chunk of migration, because as I said earlier, people move because of labor, people leave their kids behind, and left behind children who are looked after are a group where we've shown in a publication in The Lancet that conclusively they tend to suffer a lot of disadvantage and poor health because they are left behind. And there are things we could do to mitigate against that impact, both in terms of how they are looked after, how people move, and whether they can move with their children or not. It's within our gift to do so. UNICEF, in that report I alluded to in my report, has got a comprehensive summary of the actions they expect. And not surprisingly, those actions center around both health and education. So if we are to respond to the needs of kids, we must be prepared to make sure that health systems are ready to receive migrant kids, that they're ready to deal with emergencies for children, that schools can respond, be able to provide education remotely, be able to use technology to make sure that kids are able to develop even in the worst case of climate crisis or migration, and that is a combination of all of those actions in health and education that would make a difference to kids.
I appreciate your thinking about novel ways to intervene for children, technology. You know, COVID was supposed to have sort of transformed the way we interact, and I think we're now learning that there are both benefits from moving to a virtual world and some harms as well. We're going to speak more about solutions and interventions in a little bit, but I don't want to leave people feeling dire for most of this and then save all the solutions and positive actions for the end. Are there positive lessons that we can learn from the pandemic response, especially for children or for vulnerable populations?
Yeah, there are lots of things not to learn from what we did in the pandemics, right? But there are a few things that have gone well, and some of that is the increased healthcare access by certain state actors and access to immunization and vaccination. Some of that is definitely how we've used technology to provide healthcare remotely. The entirety of our health system, for example, in England, providing primary healthcare, moved to providing consultations online. And sadly, a lot of that has been traced backwards. But the lessons from that are there and visible to everybody. The telemedicine and the use of technology to provide some elements of healthcare, and I genuinely mean some, because there will be many elements that would remain important to deliver face-to-face. We need to utilize those, especially in the places where they do not already have access. So in thinking about universal health coverage and where we go next, it's really important that we pick up those lessons and replicate them as efficiently and effectively as possible.
Do you think it's possible to think about a response to climate migration without talking about universal healthcare access?
No. The central recommendation of our Lancet Migration Commission is that if there's one thing health systems and societies can do, is to improve healthcare access. And that means universal health coverage. When we say health for all, it actually means all, not all excluding migrants.
Well, that sort of dovetails into this is a day to celebrate World Health Day. And in fact, every year the WHO has a different theme for World Health Day. And the theme this year is sort of like my health, my right, and sort of thinking about the right of individuals and sort of trying to centering human rights obligations to all individuals, particularly to access to health care, regardless of where they live around the world. So we'll come back to that. I'm sort of torn. Does anyone have a pressing comment or question they would like to interject at this point? So you don't, we have a hand. Shall we take one comment or question, and then we will, I think there's a microphone back there, and then we will move into politics and migration and policy, which I think will be an important issue for the Chicago crowd.
Hi, everyone. I don't know if this is pressing, but I was just wondering with the SDGs, there's like 17 of them with 169 targets. Just looking at that is pretty vast, you know, it's a lot. So with what you presented with us today, would you say that there should be not some that are more important than the others, because they're all important and they're all connected, but do you believe that there are some that we should probably focus on first? And we're all lucky to have each other and have the same interests. And like if you are looking at some of these websites, you might even know what they're talking about. So how can we take the information that we are getting and take them into our communities and foster meaningful conversations?
Thank you for that. So I heard a few questions in there. I heard questions about local action and local climate action, but also the challenges of what's happening at the international level around meeting international goals around sustainable development. We're definitely going to talk about policy. Do you want to think about the local or the international at first?
Well, let's start with the SDGs, right? So many critics of the Sustainable Development Goals essentially have that point, which is it's too many things, and too many things means lack of focus, and we would miss out on the important ones. I would argue that your point about interconnectedness and the fact that if I pick health and say it's the priority, actually the determinants of health sit across the other SDGs. Therefore, singling out one runs a risk that the one thing we need to do to actually deal with the one we single out, we lose track of. There was great progress with the Millennium Development Goals. The tragedy of the SDGs for me isn't the multitude of actions that are required, but the fact that we are not moving with the same momentum and energy as the MDGs. And I would love and hope that your second question, which is how do we mobilize communities, is actually the solution to the first. Ultimately, with 8 billion of us on the planet, and with a significant proportion with the ability and will to do something in each of those areas, if we can convince enough outside of the small policy cycles that talk about these things, then there is enough bandwidth among humanity to take everybody with us. And to do that, it is about community action. It's about translating our jargon and gobbledygook into things that people would understand. With the climate crisis, I'm excited and delighted by the youthful energy, right, that has taken the narrative right out into the community. While in my middle age, I may not be exactly the one that would do the protests and some of the tie myself to roads and the more extreme actions that our kids take. I completely see their point, right, about the importance of that issue. But on every single one of those issues, we need to find ways to mobilize communities, to mobilize the young, and to mobilize those that don't normally act to listen. And that way we would tackle all of them.
I'd like to maybe come back to that comment about where did the initiative go? Where did the impetus go? Like, why is there fatigue, and what's the antidote to that fatigue? Because I think it's there, right? We feel it even domestically. We feel it in local politics. So how do we channel that beyond it certainly helps to have that intergenerational enthusiasm, but to make things actionable, it will take, multiple generations' efforts on that.
Yes.
But maybe we should tie it back a little bit to your comment about, let's explore what migration is, and so pull it all together. So climate change and migration, specific concerns. We've talked about children. We've talked about how we'll have trapped populations of people who cannot move, and those populations tend to be older. And so we'll see all the amplification of chronic illnesses that we're going to see, that we'd normally see in elderly population. Are there other vulnerable groups that we think we should comment on? I often think about women and reproductive health needs, because the path of migrancy is fraught, unfortunately, with violence, and often sexual violence as well.
Absolutely. I think it's really, really important that if we are going to tackle threats to humanity, whether it is, in fact, anthropogenic climate change or some of the consequences, including conflict and the effects on the most vulnerable, should be at the center of that. I've already talked a lot about kids, but I think other vulnerable groups, and in particular where there are disparities in economic power and access to weapons, etc., women suffer an outsized proportion of the violence, both physical and mental, with risks to their reproductive health, to sexually transmitted diseases. And it's a central part of the conversation. There's a recent damning report on the EU by Medecins Sans Frontières that documents the tragedy that is unfolding in Europe and in neighboring countries related to migrants. And a large chunk of that is stories about really vulnerable people, where we choose to look the other way and they suffer those. So in taking global action, while of course we can act across the board, I'm very, very clear that we must have a gender lens. We must look at the elderly that are more susceptible and vulnerable to the chronic conditions that they may have as a consequence of either migration or climate change. And we must look at the poorest in society. So poverty is also a big source of vulnerability. And when you act and support the groups that are at risk, you must have a focus on ensuring that people who are living in the deprived situations get prioritization.
I don't know that poverty is a word that we tend to talk about very much anymore. It has fallen off not that it should, but it feels like it has fallen off the international agenda or the international development agenda when there are high profile conflicts, when there's risk of much more political instability. People aren't thinking as much about the core issue of how do we transform sectors, particularly agricultural sectors, labor sectors, to sort of reflect what's happening already on the ground in response to changing sort of environmental conditions.
Yeah, sometimes it feels frustrating and bleak when we are focused on immediate challenges and we lose sight of really important issues that when you just reflect on your humanity, we would all agree that it's important, right? I say the answer lies in what we were talking about earlier, which is community action, organizing ourselves into groups and repeating the call so that when the vast majority of society stops listening, that those that care and are most passionate about try to convince those around them and their communities, yell as loudly as possible until the media hears them, until political leaders hear them, and until policymakers change direction to make it pertinent and relevant again. Giving up is not an option.
Well, this is a passionate crowd. Chicagoans care about their politics and their policy. So we will carve out time to think about that. You also just alluded to another phenomenon, which I think is probably really important to highlight with migration, which is urbanization, right? You've commented how most migration begins internally. People don't cross borders, right? We think of migrants as coming over borders en masse, but I think the numbers are 3 to 4% of only 3 to 4% of people in the world are international migrants. Most displacement occurs internally, often to cities. What does that mean for health? Because in higher resource countries, we think of urbanization as a positive step for health. Is that true elsewhere?
Yeah, so that's interesting. In a piece of work we're doing with a colleague, Julia Pescarini, at the London School of Hygiene with Fiocruz in Brazil, where they have very elegant cohort systems that linked data about mortality, access to healthcare, access to social welfare that you could look at. Some of the findings suggest that and this was a specific piece of work that Julia conducted, analyzing access to care for pregnant women and their babies born. It was fascinating that across Brazil, what happens is it depends on where you move to. Mm-hmm. So that internal displacement, if you move to a city with a higher development index, you have better birth outcomes, you have less ill health in the postpartum period and in the kids. If you move to a city that is poorer with less resources and access, you have worse outcomes than you had before. Absolutely fascinating. So in a health system such as Brazil's, where they can actually intervene and make a difference, that is the beginning of, I think, appropriate analysis to inform a change in policy and direction and provide specific support to those women. And you're absolutely correct that most migration, it's absolutely normal, right? We don't even think about it. If it gets too difficult, if the sea level rises in New York, what would happen is people would move to Chicago and etc. So it happens all the time, but ultimately that's what people do. And then when it gets to the point where the opportunities are more difficult or there's competition for resources, people then start crossing international borders.
Well, I thought COVID was sort of a harbinger of that. So even in the US, you saw people moving out from more densely urban areas into smaller cities and to secondary cities. And in fact, I think it was Buffalo and Duluth, I saw headlines that were now advertising themselves as future places for climate refuge. So people are thinking in cities ahead about how to not just market themselves, but sort of recognize that you're going to have this inward movement. Well, we've talked about poverty. We've talked about all the ways we need to prepare. Maybe we can talk about policies and politics, which I think captured the one question that we had so far, and we'll have more. Where do we start? Do we start locally? Do we start internationally? Dare you comment on the state of international negotiations at this point?
So I'm a lot more optimistic than the media narrative would suggest about the possibility that when we are pushed to the corner as a species. The tragedy of it, though, is that by the time we act, it would be late for millions of people. We've shown during the pandemic, right, when we were pushed to the corner, the entirety of the scientific community came together and multiple vaccines against COVID appeared, and we ultimately acted too late for 7 million people. It would probably be the same narrative, and the tragedy of it will be that those places with the most vulnerable people in the world would get the effect. The consequence of that, for me, is we need to ramp up the conversation to get those urgent conversations that need to happen when the crisis happens, to happen now, for countries and communities to look seriously at what they are doing in terms of their carbon footprint and take policy decisions that would take us to below 1.5 degrees above pre-industrial levels. And we know that we are not there, right? Like the global temperature in March was, 1.68 degrees in the North Sea, which I know everybody says is El Nino. And I know that Dr. Olopade says I'm the pessimist. It's lovely sunshine in Chicago. But if La Nina comes later in the year and the temperatures don't drop, then we know we're in trouble. And I hope that this is a fluke and it's just simply because of El Nino. So I would say in terms of global politics, if the signals appear to change, the world would move in the right direction. If they don't, we need to organize even more than the current youthful action I described earlier and convince our policymakers to sign and commit to action more quickly than they have. That's not to say there are not people acting. I'm really proud of our National Health Service in England. Ignore everything you hear about the media. In my local health economy in London, I sit on our integrated care board, and we look at climate and we take it seriously so that across our hospitals, major tertiary hospitals, University College Hospital, the Royal Free Hospital, we've agreed to take action. So for example, the carbon footprint of inhalers is large, and we took the decision that we're going to look at alternatives that do not have the same carbon footprint. We're looking at ways to reduce the carbon footprint of people getting to work, our doctors, our nurses. We're looking at our estates to think, how can we make our buildings better and eventually net zero? So there are many places where people are taking action. Another example is the US. Between 2005 and 16, thereabouts, the number of coal-powered plants that were shut down here, I mean, it's huge. And the amount of carbon into the environment has been reduced to that. So sometimes we need to remember, despite all of the pessimism, policymakers can and do act, and we just need to convince them about the urgency when they forget.
So I love this idea that you don't need to go outside of your system and expertise alone to make a change, that you can take the system, domain, field that you know best and think about how to adapt. And I don't think that people think that healthcare systems themselves have a carbon footprint, which we can reduce the contribution for. Do you want to tell us a little bit more about the ways in which health systems can adapt to climate change while reducing its carbon footprint?
Yes, so we talked about universal health coverage and therefore the need to provide healthcare to billions of people around the world, right? What we must not do is recreate the exact systems, hospitals and big towers that we have that are polluting. In providing healthcare for the world and achieving universal health coverage for everyone, is we have to build health systems in such a way that their carbon footprints are substantially lower than what we've done over the last couple of 100 years in developed societies. Do it in a way that the same quality of care can be provided, but make sure that the buildings are designed in such a way that they have a lower footprint. Ensure that people are housed. There's this fantastic idea in Paris about the 15-minute city. Make sure that health workers are able to afford houses nearby to where they work and therefore can get in without generating an additional carbon footprint. Generate technologies that again do not have high, for example, the tragedy of the inhalers, life-saving tools, but then with a large carbon footprint, but there are alternatives. So there's a whole list of things that we could do in health systems that would actually contribute substantially to the effort. And then we'll be in a better place, right, when we speak to people in other industries to say, look, we are serious about our own footprint and you need to do the same.
I've been thinking a lot about how hospitals and healthcare systems and clinics are no less vulnerable to climate emergencies or catastrophes, whether it's heat waves or floods, than any other infrastructure that we have. And we saw that with Hurricane Katrina, when you saw major hospitals being flooded, and then crisis evacuation of patients and people dying. And we saw that in Hurricane Irene in Puerto Rico, where you saw the devastation of healthcare systems, which ended up having effects on supply chain, particularly generic drugs around the United States. So do you have thoughts on how healthcare clinics, hospitals, dialysis clinics, pharmacies, the entire infrastructure of healthcare systems can make themselves more climate resilient?
Yeah, so the concerns about when these disasters begin to increase in frequency as a consequence of climate change, or just simply other anthropogenic or natural disasters, is precisely the reason why the concept of climate resilient health systems has come up. And the idea there is that all health systems, especially those that handle emergency care and respond to people in dire need, should have in place very clear plans as to what you do, how you ensure you're able to transfer the provision of acute care and things that cannot wait to alternative sites, how you can do certain things remotely, how you can transform the provision of care so that you can go out in the community where needed and provide that health care when there is a crisis. What is the fallback option when your main tertiary or secondary or primary care hospital shuts down because there's a crisis, whether it's a flood or some other natural disaster? And all of our hospitals, all of our health systems should be doing that because we will need it.
Of course, the question is, this major infrastructure effort is expensive.
Absolutely.
There is a commitment at COP to I think there's about 700 million in the loss and damage fund, but where are the funds going to come from? And maybe this allows us to think about differing responsibilities among states.
Right. So I would start by saying the cost of inaction is a lot more. As I've shown with the pandemic preparedness effort, it's going to cost us a lot more not to prepare. I'd secondarily say already the cost of the climate crisis in terms of labor loss probably justifies substantial expenditure by governments. But ultimately, I think this is about thinking carefully about where do we get the funding. Yes, it must be governments must commit, but it is also the responsibility of the private sector to contribute to this. It is also the case that we must make sure that the distribution and contributions are fair so that A, those of us that have an outsized carbon footprint and contributed to the pollution, who turn out to have more wealth, are doing our fair share of funding the climate, the preparedness needed for the climate crisis, so that it doesn't fall on those so it does fall on those with the broadest shoulders to bear the costs. And I do not think it is beyond our ability to find the resources.
We have an eager questioner. Hello, thank you.
Hello, Lopati from the University of Chicago. Great presentation and conversation, bringing health into the picture as we reflect on climate change. You know, I've always wondered, because if you look at globally, the concept of energy poverty, half of the world's population don't have access to power. Okay, and what they end up doing is they do the usual thing to take care of their families. They cut down trees. They do all of those things to stay alive and feed their families. And as she mentioned a while ago, we've had problems with Katrina. We've had flooding in Battery Park in New York. And we do have the resources to throw everything at it. To make sure that we bring Battery Park and Katrina back to life. I'm interested in your, but we miss the opportunity to actually connect the dot, because we have half of the world's population cutting down trees, cooking, and those are where the energy, weather forcing, factors are. I'm interested in your take on the responsibility of high-income countries. We have the resources to mitigate some of those challenges, but if we look out to those who are energy poor and are causing some of this pollution, black carbon, and some of those weather-forcing factors, I'll be interested in your perspective and how policy can actually be forward-looking to not only looking here, but have what I call a global state of mind.
Take it away.
Yeah, so my first reaction is kind of to reiterate that the majority of the pollution and the damage to the ozone layer actually comes from us in rich countries. I reckon and my wife is in the audience, with our 2 kids, our carbon footprint combined, the 4 of us, is probably as much as my village back in sub-Saharan Africa. Okay, maybe I exaggerate a little. So we have a responsibility because we are causing the damage, right? So, and our reaction to that really ought to be that we provide those things, i.e. energy and better ways to cook and a livelihood, because it is the morally right thing to do, because of our humanity, because it isn't right that a large proportion of the world do not have access to the ability to cook their food and to keep warm when they are cold. And we do so. And if that has benefits to the climate, then fantastic, and that would contribute in some way to getting us towards our goals. But our primary reason and motivation for doing so has to be because we caused this and we need to fix it.
Thank you. We have a online audience and we have a question coming in from online. So let me read you this question while I think we might settle one person more at the podium. Do you subscribe to the One Health world view, which calls for balancing the considerations of the health of animals, plants, and people towards better health for all? And I suppose if you can link that to migration, that might be helpful.
I thought that's a very easy one. Yes. So the idea of One Health, thinking about the environment, thinking about all the other species that live within the environment, thinking about us and how we interact with each other, is about the most sensible way. We have one shared planet, right? And the actions of one element of it affects the other. It's actually interesting. I was thinking about Dr. Olopade's question, and I didn't say when I was answering that one of the most effective ways that you can reduce the global carbon footprint is essentially stop our species. We are the problem, right? So if we are thinking about animals and we're thinking about the environment and we're thinking about our habitats and livelihood, then of course One Health is a sensible and the most logical way to tackle diseases that are in animals, to tackle diseases that are in humans. The next pandemic, 100% would come because of a zoonotic transfer of a virus, likely a respiratory virus, from an animal. So the only way to anticipate and prepare for the next tragedy will be One Health.
Then we're back to how do we solve the collective action problem. But do we have one more question for the podium, for the microphone?
Yeah, and I think it may touch on the collective action problem. I'm Mike Strautmanis at the Obama Foundation. And one of the things that we have found is that there are young people, thank you for that, who not just have energy and action, but actually have meaningful solutions in their own communities globally. And so, but we have very hierarchical, very patriarchal societies and systems that don't allow these ideas that are working to see the light of day, get scaled, get funded, et cetera. And I'm wondering in your work, if you've seen young people in the global South, in different sectors, who are bringing, from their perspectives with their education, staying rooted in their communities, but also finding viable solutions to the issues that you're describing.
Yeah, so that's a really, really, really important point, because ultimately we know that global economies, nation states, and international policy is made by people like me, older than me, usually lighter complexioned, and that's a tiny, tiny subset, right, of humanity and ideas and solutions. So not surprisingly, the majority of good ideas sits in the rest of the world. And how we change that dial, how we change that narrative is an important part of the solution. In my world and my community, we actually actively, those of us that are graying, actively think about that when we set out, say, the Lancet commissions that I've run, to have a youth wing, to give them an equal voice around the table, to support where necessary finance those communities to have a voice, to organize themselves in the way they see fit, because the way we think they should be organized may not actually the way that they want to work and they are most effective. And there are numerous examples on that. So for example, I'm currently on the Lancet Commission on 21st Century Health Threats, which is led by Chris Murray at the University of Seattle. University of Washington in Seattle, and Natalie Kanem, UNFPA HPA. And in that, we have a number of youth representatives who then represent a voice and thinking on ideas. And as we look through these multiple threats, including the climate crisis and pandemics and the demographic crisis, etc., we get superb ideas that we include into our thinking and recommendation. But the reverse is also true. They can access our network and communities and be able to channel the communication the other way around. So, and that is the only way. Those of us with access to policy power and be able to make change, listen and enable and ensure that we allow those communities a voice to act.
Thank you. I wasn't sure if there's another question. All right. If we can keep it succinct, but I want to hear the crux of it.
I just spent 4 years in Vietnam, and I was speaking with an epidemiologist there, and she was doing research on using antibiotics. And I thought it was from the overprescription or overuse of antibiotics, but actually it was for livestock antibiotics. And what she had told me is that now there's rising levels of antibiotics in soil and water and feed and everything. And what's difficult in Vietnam is that these farmers who need to survive with their herds, they feel pressure to continue overusing these antibiotics or else they won't be able to meet their needs. So my question is, what is some of the current programs or education or models to help work with or give more resources to these farmers so that it can prevent what could be more superbugs, especially in the context of migration and movement with more resistant bacteria?
Thanks. So antimicrobial resistance is one of those big threats that humanity, when I said global health threats that humanity faces, without a doubt. If we go back to the pre-antibiotic era, you'd get a pneumonia, and whether you survive or die would be a flip of a coin, right? And we don't want to go back there. The problem you describe of the use of antibiotics in livestock and in agriculture is an economic one. And it's one that illustrates why the One Health approach we alluded to earlier is central to our response to a number of problems in global health. Because if you did take a One Health approach and you did use the perspective that this is an economic problem, then you can walk outside of a strictly medical cycle and think that, well, what this needs is actually people in industry to provide the narrative, the incentives and the alternatives to those farmers to act and behave differently. And solutions exist outside of healthcare, right, as to how you alter behavior by providing people with viable alternatives where they can see that the yield of their farming remains optimal without the same amount of antibiotic usage. And then you could reduce that usage, possibly gradually, possibly radically, depending on the solution that is used. But it isn't a problem that affects Vietnam alone. It affects multiple countries, and people do use. And if there is a challenge, actually, the flip side of that is, in many places, poor places, humans with ill health don't have access to antibiotics, while we are overusing it in others. So we need to probably tackle both ends.
Well, I think that sort of underscores the importance of that people are adapting to the environmental degradation, and what can we do to keep people in place? What can we do to keep them in sustainable livelihoods? Because for the most part, right, individuals don't wish, and communities don't wish to travel, to be displaced, to be separated from their ancestral homes, but to find a place to adapt. And if we had more time, we'd talk more about that. But listen, you have the last word. We spoke about the importance of not leaving audiences in a state of eco-distress or eco-anxiety, as the terms you may see. And I am a great believer that the antidote to eco-despair is action. I don't know if you have a final few comments. Do we have a quick question?
Yes, very, very interesting presentation. That is really a warning to us all. And my question is about climate change. My understanding of it is that there are at least two elements of climate change. One, the carbon footprint, call it, from human beings and industry and cars and so forth. Secondly, that climate change for millions of years, the Earth has vacillated between cold and hot temperatures. And that's caused by the tilt of the Earth that is slightly different over time. We're at a 10,000 year period of moderate temperatures. Now, my question is simply, can you define how much of climate change is related to human activity and how much of it is related to the natural order of things by the tilt of the Earth?
Thank you. I think this is an opportunity to think about attribution and then any positive notes that you want to leave the audience with.
I mentioned in my talk that one of the worst things we do if we attribute erroneously effects we're observing, whether it's migration or on health, to climate, when in fact it isn't. The majority of what I said strictly refers to anthropogenic climate change rather than environmental and other man-made changes in the environment, or long-term changes and cycles in weather that happens and affects the planet. The very clear and detailed response to the answer is that all of the modeling that's been done suggests that in addition to a gradual trajectory that you'd expect if you are having a cycle of change, there has been an acceleration that coincides post-industrialization that is linked and is predictable by models, that if you take out the effect of what we are doing, the trajectory of increase continues. When I showed you the heat-related mortality, there was a 39% increase in heat-related mortality. And when you add the anthropogenic element, which is a factor that is not predicted by the actual increase, you see that doubles. So there is actually very clear and detailed work that suggests that yes, both things are happening, but in fact, some of the effects are definitely, and the acceleration and the consequences are definitely due to anthropogenic climate change. Climate researchers, I would urge, would have to be incredibly careful and thorough and only attribute disasters where they have clear evidence that it's because of anthropogenic climate change, because of the risk that detractors would pick on the one example you use that is incorrect. And fortunately, the colleagues I work with are very passionate about that. And in all of our work, if you bring out an example, there is a check on your attribution hypothesis and whether you used appropriate attribution methodology before you say this is due to anthropogenic climate change. But I would like to end more optimistically. I am a glass half full, not half empty person. I believe in the ability of our collective power if we organize. I believe in our ability as a species to innovate. I believe that, yes, there's a risk that the climate crisis, as shown by the modeling, could lead to very adverse outcomes. But if we act, and we act now collectively, I also believe that there is a prosperous future that is both economically viable, with a lot of health core benefits of taking those actions, and with very clear positive consequences. And there are numerous case examples in our reports and the Lancet Pathfinder Commission of action taken by communities and countries that are entirely positive, that should be replicated. Some evaluated in randomized studies that should be taken, that would mitigate the consequence and hopefully get us to that fantastic nirvana. Thank you.
Thank you for ending on a note of optimism. I think we're out of time, but we would look forward to speaking with you more over a canapé and a drink, perhaps, and we can continue to talk about attribution science.
Yeah, and on that note, I really must thank people who I didn't remember to thank at the beginning. And Michael is there from the Obama Foundation, a great Chicago institution. And I'm glad that you had the opportunity to ask a question. And of course, John Palfrey and the MacArthur Foundation, who have really been very keen on climate change, and really another great Chicago institution that will continue this discussion. I think we really wanted to make sure we brought this to the city. And as a global city, Chicago cares about migrants. And this has been just so amazing in terms of what we've been able to learn today. So I'm sure you want me to really give a big round of applause to Professor Abubakar. And thank you so much for coming all the way from New Haven to. Yes, yes. So this programming will continue, but we have food and conversations, and I hope that you'll all enjoy this evening. Thank you.